So inappropriate attitude of therapists can affect negatively and compromise clients' well-being. And some of these points that I will mention here are spiritual avoidance. For example, avoiding to integrate spirituality into practice. So, like I said, some therapists may have biases. Some therapists do not want any kind of a spiritual approach into their practice because they don't know how to and they are not trained into it. So that can be, or that could be just religious rejectionism, just having that belief that religious beliefs are outdated, or due to personal perception or biases, personal biases that a therapist might have, that they would go towards religious rejectionism and they would not incorporate it into therapy, and that can affect the outcome of the therapy with those kind of clients who are looking for a spiritual solution in their life or for their issues. So inappropriate attitude of therapist is important to mention because, of course, your relationship with the client affects the outcome of your therapy. So religious intolerance, lack of religious diversity, or the lack of the training, that is multicultural or multi-religious diversity training, can also cause this intolerance. The other thing that can cause religious intolerance, which I have talked about, is as we grow older, not having that love for the diversity or religious diversity can also make us either disengage with the religion or with those kind of issues, and we are not able to integrate that, or we are not able to know because we have stopped growing and learning in religious education ourselves, so we are not advanced in that. So of course, if there is a lack of education, religious education at any point, then that can also affect, and a person would not be able to integrate that into therapy or counseling sessions because of the religious intolerance, religious or spiritual arrogance, and that means having a superiority complex that my way is the right way and excluding other. And that's why a therapist have to be very well aware of his or her own spirituality and be very, very cognizant and respectful of the client's spiritual oriented approach. So whatever approach that they have or spiritual oriented belief that they have or what they're coming from, so a therapist or counselor has to be aware of that and be able to respect that and integrate that into therapy and let the client express themselves. Over inclusiveness, that means minimizing spiritual differences. So there are differences within each faith tradition where there are commonalities. There are also differences that separate us and differences that divide us, but those differences should not be something that divide us, but more as like we learn from those different belief system. So over inclusiveness basically means that you minimize those differences and you try to undermine religious differences. So we have to have a very realistic approach that there are commonalities and there are differences within each religious community and within each religious tradition. So we cannot really minimize that, and we have to appreciate the differences at the same time how we appreciate the commonalities. Exclusiveness means having a superiority complex, intolerance to religious diversity, and those things can be eliminated as we grow into our studies, if we learn to have a multicultural and multiracial and multi-religious diversity training, then we will be very well equipped and be able to work with a large population coming from different background.